Good afternoon, friends. This is Dr. Amarendra Singh. I'm working as a senior consultant cardiothoracic and vascular surgeon at Tumbe Hospital, Chadarghat, Hyderabad. Uh, on this occasion of World Heart Day, this is very big occasion for us, and I want to give something. Uh, want to share some thoughts to our colleagues, friends, and our patients. So, uh, heart disease, as we know, that India is now becoming a world capital for diabetes as well as heart disease. Heart diseases are now the second most common cause of death, barring the infectious diseases in India. And unfortunately, with our changing lifestyle, becoming more sedentary, and eating habits are changing with more use of uh, junk foods, oily fried foods, and lifestyle modification in that form of smoking, obesity. These are leading to a pandemic, not only for coronavirus but for heart disease as well. So I will briefly describe you how the heart pain or the angina, we call it, comes. Generally, this comes in the form of sometimes chest pain on the left side. Sometimes it is a gripping type of pain. Some patients have pain in the left shoulder joint, radiating to the means moving that pain is moving to the left hand. Sometimes patient present with the choking sensation. Sometimes they present with the uh, pain in the jaw also, pain in the teeth also, and sometimes they present like heartburn also. So many patients tell us that we have acidity, severe heartburn happen, and so these symptoms are may or may not be associated with sweatings and all. So these are the symptoms. Usually these occurs in age group of around 40 to 70 years, 70 to 80 years. But as I said, mentioned with increase with the worsening of lifestyle like obesity, smoking, junk food, no exercise, these things leading to the patients are presenting in quite younger population also. So we should not be neglecting these kind of pain if it is happening in a younger patients also who are having these kind of problems like smoking and obesity and all. Even previously, we used to say that females before their menopause they are safe and prevented. But with more and more females having diabetes and obesity, they are presenting early with coronary artery disease. So, friends, don't neglect these symptoms and contact your hospital as early as possible. And the diagnosis part is really very simple. Most of the time, diagnosis can be made by a simple ECG test also, which is available now most of the time. Some, if it ECG is not conclusive, sometimes we take blood samples and to blood test in the form of troponin I, troponin T. These tells that there is a damage to the heart muscles, which is caused by this coronary artery disease. And simple non-invasive test of echocardiography can detect the heart disease. I will not go into much details. So symptoms are there and tests are really simple, and we can make the diagnosis very early in the disease process. And then you might have to go for angiogram, and then depending upon the situation of your coronary arteries, you might need just medical management, or you might need stenting, or you might need coronary artery bypass surgery. So these are the basic symptoms, investigations, and the management. The most important thing on this World Heart Day, the message I want to give to my friends and colleagues is that please don't ignore the symptoms. And if there are symptoms, then once you are diagnosed with it, then please go ahead with the treatment. And there are lifestyle modifications which needs to be done after the procedures like stenting or bypass surgery. Even these recommendations are for patient or for those patients also, or those persons also who doesn't have symptoms but want to maintain a good lifestyle and want to prevent coronary artery disease. This first and foremost is regular exercises. We don't ask you to do regular hardcore exercise like gymming and weightlifting and all. Simple walking is enough to maintain the cardiovascular system in a proper shape. Walking should be at least for the 45 minutes to 1 hour, minimum 3 to 4 days per week, and it should be covering around 4 to 5 kilometers in that 45 minutes. Try to start with lower duration like 10 minutes, and then weekly increase by 5 minutes to these every week, so that you can reach up to 45 minutes. Just take it slowly. Try to be more as regular as possible. Then meditation is there, which very helps in preventing coronary artery disease. It reduces the blood pressure, it reduces the tension, and because of stress, so many harmful chemicals are released in the body. So meditation helps in reducing the that stress. It helps in reducing the blood pressure, which is a leading cause for coronary artery disease. Third is eat healthy. Try to include more and uh, more fresh vegetables and fresh fruits in your diet. Cut down on your fat intake, especially a lot of non-veg items. Better to take white meat, like fish is there. Fish is quite healthy for the body, and chicken is also quite healthy. Avoid or reduce your intake of red meat like mutton and beef. And if we follow these things, then I think we all have a long and healthy and fulfilling life. Thank you for your patient listening. Thank you.